Welcome back once again. I'm on location today with Health South Rehab Hospital, and I'm talking today with Dr. Heather Walker. And Doctor, we're talking today about a medication that's out to help folks who have had or still have ULS. First, let's talk about what exactly is ULS.
So ULS stands for upper limb spasticity, which is a condition that can be encountered by patients with injuries or illness to the central nervous system. So something affecting the brain or the spinal cord, whether it be a stroke, a traumatic brain injury, spinal cord injury, multiple sclerosis, or a host of other neurological disorders. And basically with upper limb spasticity, what we see is overactivity of the affected extremity where their muscles will tighten up. They can have intermittent spasms, which can be painful.
And dealing with folks who have had a stroke, sometimes hours, weeks, months, maybe even a few years after the stroke, all of a sudden something is drawing up in the hand and they don't know quite what it is, and they go to their physician, and a physician may say, we need you to go see a specialist. That is someone like you, and you can determine and see that this is the possibility of ULS when the tightening of the muscle comes in, correct?
Exactly. So with upper limb spasticity, we often see tightness of the shoulder muscles, of the elbow flexors, wrist flexors, and finger flexors. And a specialist such as myself who practices physical medicine and rehab, or a neurologist, can really look at the appropriate treatment for that patient.
Tell us about the drug that you are using right now that is helping folks with ULS.
So Xeomin is one of the newly FDA-approved botulinum toxin type A treatments for upper limb spasticity.
And again, this is FDA approved.
This is FDA approved. So this treatment allows us to specifically target focal spasticity. So if, for example, a patient has spasticity primarily in their elbow flexor and finger flexor, I can target those muscles with my injections and with this treatment to relax those muscles.
This has got to be really a huge breakthrough, especially for those that are affected by it, because it's not only physically hurting the individual or dilapidating, but psychologically as well. They may have difficulty even going out in public if their arm is drawn in. Maybe the rest of their limbs are working fine, but now this is able to relax because you're able to localize exactly where you need that injection, correct?
Absolutely. I do have some patients who are ambulatory and their arm will just draw up as they walk. So if I can target those elbow flexors and try to help relax them, that can make their gait more safe, first of all, but then it can also make them feel better about being out in the community.
One of the words that I like to use in this interview also is specialize. You specialize in this, which is a lot of things that doctors are doing these days to go right in on what is the problem with the patient, and that is wonderful. Tell us about the hospital that you have here, because this is a wonderful hospital.
Sure. So this is Health South Rehab Hospital in North Charleston. We are a 49-bed inpatient hospital, so we treat patients who have had neurologic issues such as strokes, brain injuries, spinal cord injuries, as well as orthopedic issues and other injuries and illnesses. After patients are ready to leave the acute care hospital, they will sometimes come here and stay 7 to 21 days or longer, depending on the diagnosis, to improve their functional status. They'll participate in therapy for 3 hours per day and be seen by a physician on a daily basis. And then once they're functioning to the point where they can return home, they can come back here and work with our therapist on an outpatient basis.
Fantastic. Dr. Heather Walker, thank you so much for joining us today. We've got more Low Country Live coming up in just a moment. Stay with us.